Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we're talking about borderline personality disorder. These are all questions and answers taken from Nclex RN examinations. Please hit the thumbs up button, please subscribe, and please share this video. My first question is, define borderline personality disorder. The correct answer is, it is a mental health disorder that impacts the way you think and feel about yourself and others, difficulty managing emotions, self-esteem issues, and patterns of unstable relationships. My next question, individual diagnosis for borderline disorder. I repeat, a client diagnosed with borderline personality disorder sees things as either all good or all bad. What defense mechanism is this client using? The correct answer is splitting. They say good things or bad things about the day nurse to the night nurse in order to have their own way. This is an example of splitting, putting the day nurse against the night nurse. The next question, what is the characteristics of borderline personality? Correct answer, 1. Make an effort to avoid real or imagined abandonment. Make an effort to avoid real or imagined abandonment. 2. Recurrent suicidal and self-mutilating behavior. 3. Chronic feeling of emptiness. Next question, what would be a short-term outcome for borderline personality? The correct answer, the client will express feelings without inflicting self-injury by discharge, is a short-term outcome. The next question, what is the priority intervention for borderline personality with self-inflicted laceration? The correct answer, observe patient frequently through routine activities and intervention. 2. Avoid appearing to be watchful. 3. Avoid appearing superstitious. For borderline personality, what is priority intervention for borderline personality disorder? Nursing diagnosis, disturbed personality identity related to unmet dependency needs, inability to be alone. The correct answer is help client to identify values and beliefs. Please note, characteristics of borderline personality cannot be cured or controlled successfully by medications. Help client to identify values and beliefs. My next question, what are the characteristics of borderline personality? 1. Frantic efforts to avoid real or imagined abandonment. 2. Recurrent suicidal and self-mutilating behaviors. 3. Chronic feelings of emptiness. The next question is, client diagnosed with personality disorder states, "You are the best nurse on the unit. Not all nurses are like you." The client is saying to the nurse that not all nurses are mean like you. Not all nurses are like you. They are mean. That mean nurse who never let us stay up till 10 p.m. at night. This statement would be associated with which personality disorder? I'll repeat this question. Client diagnosed with personality disorder states, "You are the best nurse on the unit. Not all like that mean nurse who never let us stay up till 10 p.m. at nights." This statement would best be associated with which personality disorder? This answer is correct answer. This is a borderline personality patient, and the defense mechanism this client is using is splitting. He's putting one nurse against the other to get his or her own way, and he's also putting one nurse against the other nurse. It's either the day nurse against the night nurses. They have to get their own way. Not all nurses are like you. That mean nurse, that nurse last night, that nurse on the day shift. This is splitting. My next question is, client diagnosed with borderline personality. Nursing diagnosis is disturbed personal identity related to unmet dependency needs as evidenced by the inability to be alone. Which nursing intervention would be appropriate? The correct answer is help client identify values and belief. Note the clients will begin to distinguish personal identity when you help the client to identify values and belief. I am going to repeat this question. Client diagnosed with borderline personality. Nurse's diagnosis disturbed personal identity related to unmet dependency needs as evidenced by the inability to be alone. Which nursing intervention would be appropriate? The correct answer, help client to identify values and belief. Note, this client will begin to identify and distinguish personal identity is the answer. We'll go next to the next question. Clients admitted from the emergency room for self-inflicted lacerations to the wrists, arms. Client diagnosed with borderline personality. Which nursing intervention takes priority? Correct answer, observe client frequently. Avoid appearing watchful, superstitious, so immediate interventions can be implemented as needed. My next question with borderline personality. Borderline personality is associated with what is the question? The correct answer is strong interpersonal relationships, but they do not have strong interpersonal relationships. They have unstable relationships. They have strong interpersonal relationships, but they do not have stable relationships, is the answer. Clients with borderline personality is admitted to the ED with Tylenol overdose from a broken relationship with spouse. Client have history of slitting wrists. What's most likely this diagnosis? This diagnosis correct answer is borderline personality. They do not have stable relationships. They may have a lot of strong interpersonal relationships. They'll have a lot of unstable relationships. They have a lot of broken relationships. So they will start slitting their wrists or arms. They will become suicidal because of frequent broken relationships. Their relationships are not stable. Please hit the like button. Please share this video. Please subscribe. Thank you. Have a good day. My next video will be antisocial personality disorder. Thank you.